The AC3 Optimus IABP is an advanced microprocessor-based system designed for in-hospital and transport applications. This video will review the basic operational functions of the AC3 Optimus IABP. For a full explanation of the operational functions and a complete listing of indications, contraindications, warnings, and precautions, please refer to the operator's manual for the AC3 Optimus IABP. The system consists of two components: the pump control display, which incorporates a touchscreen and keypad for system operation, and the pneumatic drive module with attached wheels. A 3.6-meter communication cable connects the pump control module to the pneumatic drive module. The detachable control display module houses the high-resolution LCD that shows the ECG, AP waveform, balloon pressure waveform, and hemodynamics. The pneumatic drive module contains the pumping system needed for IABP operation. The front of the module contains the following: the power switch, the balloon connection, the AC indicator LED and the battery charge LED, all the input and output connections required to receive the signals, and a USB connection port. A strip chart recorder is located at the front of the console. The dual-channel recorder uses 50mm wide thermal-sensitive paper. A storage pack can be attached to the side handles and used to store accessories such as cables and helium. The pack can be removed for transport to reduce weight. The compartment located on the left rear of the pneumatic drive module houses a 500 psi disposable or 2000 psi refillable helium tank. The AC3 Optimus IABP also has a thermoelectric baffle system to condense and remove moisture from the pneumatic lines. The liquid drains into a condensation collection bottle located in the helium storage compartment. The control display module is mounted on a bracket and can be rotated 360 degrees in either direction by pressing the button on the back of the pneumatic module. It can be locked in quarter turns. The display can be raised or tilted to allow for better visibility. To raise and lower the control module, press the blue button on the control module handle. To remove the control display module from the pneumatic module, reach behind the control module to the central section. Pull and lift the silver handle. Lift the module straight up to clear the mounting bracket. To replace the control display, slide the control module down over the mounting bracket until it clicks into place. The AC3 Optimus IABP provides several connection options for patients, monitors, and sensors. The front of the console contains all the input and output connections required to receive the signals from the patient or bedside monitor. All inputs directly from the patient or monitor are in the dark blue area. The direct ECG connection, the monitor ECG input, the direct AP connection, the monitor AP input. Direct connections ensure better signals. When powering on for the first time, the Getting Started checklist will display. A red X next to the item indicates that the item is not ready and further action is needed. A green check indicates that an item is complete and no further action is needed. The checklist provides an additional set of steps to assist in connection and zeroing of the SimpleConnect fiber optic sensor. The connections located on the right side of the dark blue area contain the balloon connection and the SimpleConnect fiber optics catheter AP sensor. The SimpleConnect fiber optic sensor will only fit one way. The seam of the connector should face upward. Push the slider gently into the receptacle until it clicks. A 2-beep tone will be heard when the sensor is properly connected. All output connections are in the light gray area and are grouped by type. The output connections allow output signals for display on an external monitor. The USB port allows information from the pump to interface with external devices. The display module includes a touchscreen interface for most operations. There are selected hard keys for the frequently used keys and safety functions. The 6 hard keys include an on-off pumping key in the lower left corner, the assist ratio key in the center of the control display, a freeze screen key, a recorder on-off key in the lower right corner, and the cursor up and down key on the right-hand side of the control display. These hard keys are always active even when the touchscreen is locked. Note, wherever the cursor is stopped on the arterial pressure waveform, the user can read the pressure at that point. When the cursor is moved down onto the balloon pressure waveform, it turns blue, and again the user can assess the pressure at the point it is stopped. The corner switch is the alarm silence key. It lets you silence the audio alarm tone. This key also provides a visual indication for the pump that is alarming and the severity of the alarm. The AC3 Optimus IABP display shows 3 waveforms and related data, each in a different color, for easy identification and interpretation. All numeric data is calculated and displayed on a beat-to-beat basis. Heart rate is averaged over 2 seconds. The ECG trace is superimposed with white during assist intervals or expected period of IAB inflation. The heart rate is displayed in green. The ECG source and gain is above the ECG waveform on the left side of the display. The arterial pressure waveform is displayed in red. The arterial pressure source, fiber optic, transducer, or monitor is shown next to the arterial pressure waveform on the left side of the display. The arterial scale is shown on the left under the arterial pressure source. The red pressure readings are the assisted beats. When the assist ratio is 1 to 2 or lower, the values displayed in white are for the unassisted beats. A therapy report summarizes the IABP therapy control setting and the patient hemodynamics. By touching the display in the hemodynamic area of the screen, the therapy status report displays. To print this page, press the printer icon button in the lower left corner of the menu display. To close the menu, press the Done key. In autopilot mode, the user can change ECG leads, sources, and gain control. However, autopilot mode will automatically change the ECG leads and source to maintain optimal IABP therapy as needed. The default lead is lead 2 when skin input is chosen. The arterial pressure signal may come from a variety of sources: the high-fidelity fiber optic sensor, transducers, or from monitors. The 0 symbol indicates the 0 status and access to zeroing and calibration functions. The current source of the arterial pressure displayed is identified, and it has been zeroed if there is no red line through the symbol. It is recommended that for optimal results to zero the fiber optic sensor prior to IAB insertion. Failure to properly zero the fiber optic sensor may affect the accuracy of the AP fiber optics. The fiber optic will automatically be zeroed once the fiber optic Simple Connect sensor is connected to the console. If the fiber optic sensor has not been zeroed prior to insertion but has been calibrated, the 0 symbol will continue to have a red line through it, and the calibration factor will be displayed below the 0 symbol. The action bar is the main operations menu. The action bar combines the assessment point for IABP operations with the control for changing IABP operations or settings. The controls related to IABP therapy include Start-Stop pumping. Note, the user can also start and stop pumping by pressing the hard key on the display control head. Anytime the pump stops pumping, a timer will start and show how long the pump is off. The mode of operations. The AC3 Optimus IABP has two modes of operation, autopilot mode and operator mode. The default is autopilot mode. In autopilot mode, the pump selects the appropriate trigger mode, timing method, and settings automatically. The timing controls display but do not operate. The AC3 Optimus IABP relies on the ECG and AP signals to track cardiac events. By continuously analyzing the patient's ECG and AP waveform, autopilot mode is designed to detect trigger points so that inflation and deflation occur consistently at the same point in each cardiac cycle. Autopilot mode and operator mode use the same criteria for the detection of the trigger point and the selection of the trigger mode. The user cannot change the trigger in autopilot mode. If you press the trigger key while in autopilot mode, you will be able to select the deflation timing method appropriate for your patient. In operator mode, a clinician can select and set most IABP functions. This will include selecting trigger and timing adjustments. The balloon pump will not override user settings. Timing must be adjusted by the user in operator mode. The timing controls will be displayed when the user presses the timing key. Even in the operator mode, the timing will automatically adjust for heart rate changes within 25%. The arrow keys adjust the inflation and deflation timing in 1% increments. There is an earlier and later key for each setting. Since timing assessment should be done in a 1:2, the assist ratio selections for 1:1 and 1:2 are also displayed in this menu. The user can also select and change trigger modes and can be changed whilst pumping. In most cases, more than one trigger mode will work with a cardiac rhythm. The user should assess both the trigger reliability and timing accuracy to determine which is the best trigger to use. Note, the internal trigger mode should only be used if the patient has no myocardial activity and/or ventricular ejection. The user must be in operator mode to select the internal trigger and then confirm to select this trigger mode. The assist ratio touchscreen key allows the user to select the frequency of IABP assist the patient will receive. The function is active for both autopilot mode and operator mode. The default assist ratio is 1:1 on startup of pumping. The user can now select the desired assist ratio. The AC3 Optimus IABP automatically sets the volume from the IAB connector. The connectors come with each IAB in the balloon insertion kit. When the connector is attached to the pump, the volume will be displayed on the action bar. However, when volume changes are required, the AC3 Optimus IABP lets you set the precise volume to be delivered to the IAB in 0.5 cc increments. The user cannot set inflation volume greater than the balloon's maximum capacity. The user will increase or decrease the volume to the desired setting. Press Apply to change the volume or cancel if the change is not needed. The pump will reset the volume in 1 to 2 beats and resume pumping. Note, do not reduce the volume delivered to the balloon to less than 2/3 of the capacity of the balloon to decrease the risk of thrombus formation. If this is done, the volume bar will change to yellow to indicate that the volume is below the recommended setting. There are 4 other IABP control keys on the action bar. The AC3 Optimus IABP has a Sources key to select and change the ECG and AP sources and functions, a Settings key to select more for advanced settings, an I key to access help on specific functions, and a printer key start-stop a recording strip. The AC3 Optimus IABP touchscreen is unlocked at startup, but may automatically lock depending on previous settings to reduce inadvertent operations. If no change has been made since manufacturing, the screen will lock within 5 minutes. However, timing can be modified by changing the setting under More and then the System tab. When the screen is locked, touchscreen controls are not available, and the lock icon will display in the lower right corner. All the hard key functions are available when the touchscreen is locked. To unlock the touchscreen, press the locked key. The unlocked icon displays. The helium supply and AC power and battery indicators are located in the upper right-hand corner of the control display. A green helium supply icon indicates the helium status is okay, the tank is on, and the fill level is greater than 125 psi. The psi level will also be seen on the screen next to the helium supply icon. A red helium supply icon indicates that the helium supply level is less than 125 psi, while a black icon indicates that there is no helium tank or the tank is off. A green battery icon with a lightning bolt indicates the battery status is okay and plugged into AC power and charging battery. A solid green battery icon indicates the pump is operating on battery power. The battery system allows you to use the system with full operational capabilities for a minimum of 90 minutes. A yellow battery icon indicates the battery status is okay, but the battery charge is estimated at less than 20 minutes. This will also be associated with a battery less than 20 minutes alarm. If the battery icon is red, the status is okay, but the charge is estimated to be less than 10 minutes, and the battery less than 10 minutes alarm will occur. The black icon indicates the battery charge is depleted, the charge is estimated at less than 5 minutes, and the battery less than 5 minutes alarm will occur. If a battery icon with a red X is displayed, the battery is not okay. The pump should not be used for patient transport. The AC3 Optimus IABP diagnostic alarm system continuously monitors operating conditions and will detect and alert the user to conditions which require a response. When an alarm condition occurs, the screen displays an alarm message, including suggested corrective actions and additional help if needed. The upper right corner of the display control head is the corner switch and the alarm silence key. The key also provides a visual indication that the pump is alarming and the severity of the alarm. The corner switch will light red for high-priority alarms, yellow for medium-priority alarms, and blue for low-priority alarms and alerts. An alarm banner will also appear on the top of the control display screen in the matching color of the priority. Note: high-priority alarms will result in an audio tone and the pumping action to stop automatically. To silence the alarm audible tone, the user can press the corner switch or the dismiss key on the alarm banner. Corrective actions information will automatically be displayed for high-priority alarms. This information will remain displayed for up to 2 minutes to allow the user to have immediate access to troubleshooting. For other alarms, press the eye icon to access actions to take. All messages and related information will be available on the display even when the audio tone is silenced. Once the corrective actions are completed, the user can resume pumping by pressing the on key. The balloon pressure waveform is shown in blue. The goal is for the intra-aortic balloon to be 90 to 95% occlusive of the descending thoracic aorta. The scale for the balloon pressure waveform is shown to the left of the balloon pressure waveform and is a fixed scale of -50 to +250 millimeters of mercury. The balloon pressure waveform, BPW, represents helium movement between the console and the IAB catheter. It is a calibrated, continuous waveform allowing objective assessment of the safety and effectiveness of counterpulsation. The BPW height reflects the pressure in the aorta, therefore the plateau pressure on the BPW should be within 25 millimeters of mercury plus or minus of the augmented pressure. BPW width is approximately the duration in which the balloon is inflated. You may leave the cursor on the plateau pressure to continuously assess pressure changes. Should the plateau pressure be greater than 25 millimeters of mercury as compared to the augmentation pressure, this may indicate the balloon is too occlusive. Obtain a chest X-ray to verify placement, as this could indicate an IAB that is migrated down in the aorta. If positioned too low, repositioning is recommended to the desired placement of 1 to 2 centimeters below the left subclavian artery. Reassess the occlusivity once repositioned. If the plateau remains greater than 25 millimeters of mercury higher than the augmentation, with proper placement of the IAB confirmed, reducing the balloon volume may be appropriate. A physician order may be necessary. Please follow your hospital guidelines.